Hi, good day to all of you. So today's topic is headache, and I hope this session will go on without causing any much headache to all of you. So today we'll be seeing about the common types of headache, how we go about evaluating these patients, how we determine. Most often the diagnosis of headache is made in the clinic by the history that the patient tells us, how we rule out and how we come to a diagnosis that this is not a dangerous headache, and how we manage the different types of headache. So categories of neurological disease. So whenever we are coming in face to face with a patient who are presenting with neurological symptoms or neurological signs, these are the questions that we should ask ourselves so that we can pinpoint the diagnosis of the patient to one of these different pathologies, so that we will be able to come to a diagnosis and we will be able to treat the patient depending upon these broad pathologies. So taking per se headache, infections can cause headache, like your meningitis, which often presents with headache, fever, nausea, vomiting. So infections can cause headache. Genetic etiologies, for example, even the very common migraine headache is heritable, and there are forms like familial hemiplegic migraine, which are characterized by certain additional features which we will be seeing. Trauma causing headache, like your subarachnoid hemorrhage, there was a head injury and intracranial bleed. All these can cause headache. Degenerative pathology mostly do not present with headache. But if we take certain degenerative diseases are most often associated with headache, Alzheimer's disease, Parkinson's disease, these patients most often develop primary headache, and also headache probably due to the depression associated with these diseases. Vascular pathology for the headache. So patient has a hemorrhagic stroke, they are going to present to us with a headache often. Toxic substances can often present with headache. Metabolic derangements, any electrolyte derangements, any hyperglycemia, hypoglycemia, electrolyte derangements, everything can present with headache. Neoplasms, primary malignant neoplasms of the brain or secondaries which occur in the brain due to a primary elsewhere can present with headache. Inflammatory causes, inflammation anywhere is going to present with rubor, tumor, calor and dolor, which means it is going to cause pain, and if it occurs in a pain sensitive area, we will be seeing the pain sensitive areas of the brain, they will be causing headache. Psychogenic causes of headache. So psychiatric patients, they can present with vague symptoms, and of these vague symptoms, headache also can be one of the vague symptoms that they can present with. Iatrogenic, we will not be able to pinpoint what pathology is exactly causing this headache in the patient. So these are the different categories of neurologic disease, and all these can cause headache. So next we are going to see the pain sensitive structures. Not all the structures which are there intracranially are pain sensitive. So whenever we have certain parts of the brain which are innervated by fibers which can perceive pain, only those areas of the brain, whenever they undergo some pathology, will be characterized by headache. So mostly trigeminal nerve and its branches will innervate certain parts of the brain, making them pain sensitive. So what are these pain sensitive structures in the brain or in the head and neck region? First we are going to see the scalp. Okay. So the skin, subcutaneous tissue, muscles, extracranial arteries and external periosteum of the skull, all these constitute your scalp. You would have learnt in anatomy. So scalp is a pain sensitive structure. So any laceration in the scalp, patient presents with pain. The eye, ear, nasal cavities and paranasal sinuses, that is your ENT causes. Whenever patient comes to us with a headache, we also send them to the ENT OPD and to the ophthalmologist to rule out causes of headache which are pertaining to the ear, nose, throat or to the eye. So eye, ear, nasal cavities and paranasal sinuses all are innervated by pain fibers. Intracranial venous sinuses. So this is one scenario which presents and something which has to be identified urgently. We have a pregnant female coming with sudden onset severe headache, or we have a young alcoholic male coming to us with sudden onset severe headache. First thing that we will want to rule out is a CVT, a cerebral venous thrombosis. You would have learnt about the dural venous sinuses. So those sinuses due to dehydration or due to certain factors in pregnancy, hormonal factors, oral contraceptive pill intake, excess alcohol consumption, smoking, all these can cause thrombosis in the cerebral venous sinuses that can present with headache. It has to be identified urgently and patients have to be anticoagulated to prevent seizures and further complications. Parts of the dura at the base of the brain and the arteries within the dura are all pain sensitive. So one thing which we have to remember is, out of the three meninges, dura is a pain sensitive meninges. So among the pia mater and the arachnoid mater and the dura mater is the one which is pain sensitive. Anything which is going to be covered by the dura, which is lying within the dura, is going to be pain sensitive. That is why we say parts of the dura at the base of the brain and the arteries within the dura. Then we have the first 3 cervical nerves and the cranial nerves. When they are passing through the dura, they are pain sensitive at that particular point. We also have the middle meningeal artery and the superficial temporal artery. All these are pain sensitive structures in the brain. Any inflammation, infection involving these areas, patient is going to come to us with headache. So where is this headache going to be? We saw multiple structures in the brain. So suppose this is the brain of the patient. Imagine that this is the brain, though it is a very bad diagram. So you would have learned that there is something here known as the tentorium cerebelli. Anything which is supratentorial is going to get radiated to the anterior part of the head. So frontal or bifrontal or right temporal region headache. Anterior part of the head is going to have a headache if structures which are above the tentorium cerebelli are going to get involved. Structures below the tentorium cerebelli, when they are going to get involved due to some pathology, we are going to have pain in the occipital region or in the neck region. And often we say whenever patient has an occipital headache, that is significant because you would have learned that below the tentorium cerebelli, the intracranial tension, the compartment is actually very narrow, and any pathology which is going to occur here causing a swelling of that part is going to cause a rapid rise in the intracranial tension and can cause herniation. So whenever you have an occipital headache, because signifies some infratentorial structure causing the headache, it is very significant. Infratentorial compartment is very small and narrow. Any pathology there which increases the ICT or increases the volume in that compartment, it is going to cause herniation, compression of the brainstem. Brainstem holds very important cardiac and respiratory centers. So compression of these centers can lead to fatality. So occipital headache is dangerous. That is the point that I would like to stress here.